Good evening and welcome to ChiroTV. This episode is going to focus on a pressing hot topic, very well known in the media and also within our local towns and not only across the Commonwealth of Massachusetts, but also around the nation. And what we're discussing is one of the major problems, the opioid crisis. My name is Dr. Scott Darragh. I'm actually a local chiropractor in Melrose, Massachusetts at Bay State Center Family Chiropractic. We've been here for about 15 years in Melrose, serving the community, caring for everybody's spine from 5 days old to 95 years old. So people often ask me if we're discussing a drug problem and you're a drugless healthcare provider, what's the connection? Well, we're going to go into that in a little bit. So first, let's identify the crisis that's at hand and why this has not only the government taking part, but also the district attorney's office, the mayor's office, politicians involved, as well as medical providers and other healthcare providers at hand. So what are we discussing when we're talking about opioids? Well, really the crux of it is addiction. And that's really the essence and the core cause of why opioids have become such a problem. Because other than that, you really don't hear so much about the antibiotic crisis, or you don't hear about the antidepressive crisis, or the antihypertensive crisis, although they have their own issues and own problems as well. It's interesting to say is this has to deal with not only the problems of addiction, but also of pain and pain management. And so a lot of times in society, pain is a very real thing. People live with it every single day. It's how we cope with it. How does it affect our quality of life? How does it affect our quality of health? And most importantly, what does it do to the internal physiology and how our bodies work? So these are questions that, as a chiropractor, I deal with every single day. And these are questions that most doctors deal with. But there's different kinds of providers. There are medical providers, there's osteopathic providers, there's chiropractic providers, there's dental providers, there's optometrists. So there's many different healthcare providers that deal with different parts of our body, whether it's our eyes, our teeth, our spine, our general body health. And so these kinds of providers all deal with this major crisis going on hand. I don't write any prescriptions. So drugs really never are an issue in my office because they don't come into my office. Patients come in with their list of medications from A to Z. But at the same time, too, as I start to work on people and get their bodies to work better and function better, the medication list tends to go down because as their body is starting to heal, they don't need the medication as much, which is a great thing. That's one of the nice side effects in chiropractic healthcare. So, as a resident of Melrose myself, I get the Melrose Weekly News. And on the front cover of last Friday, I think it was June 2nd, the substance abuse fight goes on, and it talks all about Mayor Dolan meeting with the Mayor's Coalition with Governor Baker and how the opioid crisis is becoming just that, a crisis. Well, within our local community of Melrose, we've already seen 27 people die within the past 5 years of this problem alone. Are drugs an issue? Yes, they are. They're an issue in lower socioeconomic communities. They're an issue in higher socioeconomic communities. So drugs don't discriminate, and they do not segregate by any means. It doesn't really make a difference if you're rich or you're poor. It's seen in all aspects of our life. And it most likely, and it supposedly, from what I understand, it hits in everybody's life. Not just the person that it's affecting itself, but also the loved ones that are surrounding them. According to Boston.com or the Boston Globe, there are many different articles on everything from alternatives to pain management to how veterinarians that deal with opioid prescriptions and giving them to pets, how people are using those to actually get access to medications. When things also hit the cover of Time magazine, we know we're in a real crucial time frame. The question really remains is, how does someone become addicted? Well, first somebody has a problem. They either have a pain, they either have a neck pain, a back pain. And that's usually where a lot of times too in the chiropractic world, we're starting to think, aha, These are things and problems and musculoskeletal problems that we address and that we hit upon. But opioids, for that matter, really are derived from the opium plant. And then when it gets processed through the pharmaceutical companies and they make the oxycodone, the OxyContins, physiologically in the brain, it starts to trigger signals of, I need this more, I need this more, I need this more. So therefore, the patient starts to rely on that. The pain doesn't go away, and so you get into a physiological cycle where the nervous system basically can't discern the difference. And so therefore, the cycle, the dependency, the addiction psychology starts to come in, and therefore the person will become dependent on the medication. Now, over time, that can really wreak havoc, not just financially, but it can also wreak havoc on the person internally. And in order to kind of break that addiction, there's many different ways to go about doing that. And so a lot of times too, and we're also seeing in the society where we're actually starting to see commercials of side effects of the medication and how we can actually treat those side effects. One of those things is opioid-induced constipation. So we start to see constipation now has a drug from the side effects of the opioid medication that pharmaceutical companies have already started to address. And not only have they addressed it, but they're actually doing mass marketing and actually capitalizing on these side effects from this actual crisis point in the first place. A couple months ago, I had the privilege of sitting on the Eastern Middlesex Opioid Task Force alongside of a dentist and an orthopedic surgeon. The crowd basically was local law enforcement officials, health education specialists, hospital administrators, and we all discussed basically different aspects of how this opioid crisis is affecting not just the prescribing tendencies of physicians nowadays and the dental physicians nowadays, but also how it's impacting different aspects of the healthcare professions and how we actually can help. So as a chiropractor who specializes in disorders of the spine and actually allows people to get their bodies to work better through the adjustment process, one of the questions that was addressed to me was, how can chiropractic really address these aspects of helping people that are in addictive situations? Well, it really comes back to what made the person get addicted in the first place. Maybe they may have had a surgery and they needed that pain medication. Maybe they are just having a very addictive personality and got strung on it. Maybe it was because of a back pain or a neck pain. So when we start to look at how back pain is one of the #1 cause of disability worldwide, it's really no surprise where chiropractic is put into the spotlight as to how it can really make a difference. When you start getting questions of which roads lead to spine surgery, and we start addressing how chiropractic before spinal surgery for chronic lower back pains, then you really start to understand and you start to see how our profession really is underutilized and severely underutilized in society today, and at the same time too, how it really needs to be advocated for patients, how it needs to be put into policy, into hospital policy, as we see also more people learning about the healthcare, because even as we're the 3rd largest healthcare profession in the world, people still to this day do not understand how we do what we do it, and what we do basically. And so education is a large part of my profession, and it's also a large part of my day-to-day, in taking care of patients. So is this opioid crisis going to go away anytime soon? People want to know, they want to know solutions, they want to know answers. And a lot of times too, one of the things, and sitting in that district attorney, the Middlesex County panel, was that we were just talking. We're talking about things. In chiropractic, we focus in on solutions. If it was up to me, we'd already have chiropractic centers established within all the hospitals around the Commonwealth, and these people would already be accessing care and starting to get better, and we'd be sending them to addictive specialists and so that they can start to get off medications. So we're starting to live more of a drug-free lifestyle and starting to lessen and lessen the amount of medications. It's not to say that the medication can't help that individual for a short period of time so that the addiction doesn't manifest. That's the issue. And so practice tendencies, prescribing tendencies really all need to be kind of thought out. They need to be reanalyzed, and we also need to start looking at how we can change the public's perception of these opioid medications. When we start to look at the costs in healthcare, when we start to look at how much medical care is costing us, we're really dealing with many different facets at play. Because there's not one cause, one cure for every ailment. There's not one reason why people get sick. There's not one reason why people have to have surgery. So sitting and talking about healthcare, I wish I could give you guys a magic bullet and say, this is the answer, this is the solution for everything, but I can't. Who's to blame for spinal care costs? Who's to blame for pain costs? Is it the system? Is it our healthcare system? Do we really have a true healthcare system in the first place? And that's one thing we need to look and analyze and kind of reanalyze. Because if our healthcare system was a true healthcare system, why do you have to lose your health in order to enter into it? So it's not to say that there's not a time and place for medical care, absolutely without end. We have to have them, because if you're, from an emergency standpoint, sometimes even from a lifestyle management standpoint, if you don't take something, bodies will die and you won't have a quality of life. But we've also, our healthcare system has also elevated to a point of not so much of what medications you are, but how many you're on. I come across this problem almost daily in my practice when patients will come in and they'll give me a list from A to Z of all the medications that they're on. And it's what's called polypharmacy nowadays. There's actually a term, just like opioid-induced constipation is a term. Because so many people, when they look at you in the hospital, they say, what do you mean you don't take medication? Almost as something's wrong with you that you don't take medication. Because they're so used to people coming in on so many medications that if somebody comes into the hospital that doesn't take it, they look at you like someone's wrong. It's very backwards thinking. So the fact of the matter is, nobody wants bad health. Everybody wants to be healthy. The problem is no one knows where to get it. And that's one of the problems that we see in society today. And a large part is due to how pharmaceuticals are distributed and how they become in such an integral part of our life. And how also you can turn on the television and probably every 5 to 10 minutes and every 5 to 10 commercials, you're going to see a pharmaceutical commercial. Well, back in the 70s and the 80s, pharmaceutical companies could never do that. So it's not to say, like I said before, it's just that it's becoming more, the awareness is becoming more, and 27 people may not sound like a lot of people dying from opioid medications, although if it was a relative of yours or someone close to you, it's very close to the heart. So this is by no means is any joke. This is obviously on a federal level as well as a state level. And so, of course, the way it works in politics is that the federal government say, you know what, states, we're going to give it to you, you handle that. So now all of a sudden everything's brought down to Massachusetts and Rhode Island and New Hampshire and Vermont and Maine and all the New England states, even though this is not just a northeastern problem, this is also a, as I said before, a federal problem. As a member of the American Chiropractic Association, even this is our national organization, they've also taken a position on how doctors of chiropractic can provide alternatives to opioids for pain management. And really, that's really what we're talking about is pain management. And I'm not talking about the pain in the arm from the, like I said from before, about the post-surgical, but we're talking about the big key issues that I see in not only in my practice, but I was also seen in doctors' offices all over the country and pretty much all over the world, and that is the signs of neck and back pain. So even if those two aspects of neck and back pain could be mitigated or minimized or even directed into the chiropractic office so that the patient didn't have to rely on opioid medications, if the line of communications from the primary care doctor to from the neurologist, from the internal medicine to the chiropractor were much more open and the integration in the referral systems were much better and policies were in place, then we may see a slight change in moving in the right direction of decreasing that opioid problem. Now, that guideline in what I just discussed, I'm going to talk about in the second half of the show. in how in Rhode Island they basically created an integrative pain management program, and we're also going to discuss the results of that.
Isn't it time to take better care of yourself? If you're in the greater Boston area, see if a visit to Bay State Center Family Chiropractic is right for you. Dr. Scott Darragh promotes conservative chiropractic health care for all ages, from day-old infants to the elder population. Alleviate symptoms through total wellness, from chronic pain to migraine headaches, from chronic allergies to ear infections. A relaxed, pain-free visit with Dr. Scott delivers overall wellness by unlocking and unleashing your body's innate potential. Bay State Center Family Chiropractic is conveniently located at 340 Main Street in Melrose, Massachusetts, accepting a variety of healthcare plans. For more information, give Tina a call at 781-662-3333 and visit us online at baystatedc.com.
Welcome back to part 2 of ChiroTV, and we're discussing this hot topic of opioids and how it's having it's a critical problem, not in the state, but also throughout the country as well. As before, I was telling you that I sat in on the opioid task force in Middlesex County, and District Attorney Marianne Ryan put together her team put together the Middlesex County drug-related deaths from 2012 to 2016. And we're going to edit this into the show so you get a better idea as to where the majority of the deaths took place. So it gives you an idea throughout the state. This was updated from December 31st in 2016. As I ended out the last section, we started talking about neck and back pain. And the reason why I discussed those two are not just the only two reasons people are prescribed opioids for potential management. So we're really talking about, you just don't go to your doctor and they give you the pill and you take one pill and all of a sudden you're miraculously cured. Because as soon as you open up that pain bottle from CVS or Walgreens or Rite Aid or wherever it is that you get your medication from, you're actually visiting your doctor, not just once a day, but sometimes 3 times a day, for 40 days, for 60 days. So every time you open up that prescription, you're visiting that doctor. The doctor's name is on the bottom there. You need to understand that. And that is very indirectly. So people always say, well, once I go to the chiropractor, I always have to go. Or I see someone daily for, a couple weeks, or I see someone, 3 times a week for a couple months, so they may have 20 visits or 40 visits or 60 visits or whatever the amount. In the grand scheme of things, if you had to take 60 pills for something to get rid of it, you may take that 3 times a day, maybe 20 days. So every case is different. Every person's body is different. Some people require more care. Some people require ongoing care. Some people require conservative management. Some people do more invasive management. Everybody's different. So you always need to look at all sides of the picture, and every case is unique in that respect. When we start talking about solutions, one of the things I love about chiropractic healthcare is not only do we focus in on causes, but as we work to get people's bodies to work better through the adjustment process, and we get their brain and their spinal cord and their nervous system and their immune system to work better, as that happens, their body starts to heal better. And as their body starts to heal better, they come back into balance. So depending upon whatever the problem is, whether it's problem A or problem Z, whether you're addiction, you have neck pain, you have back pain, you have shoulder pain, you have headaches, you got migraines, your child's constipated, you're dealing with, maybe you're dealing with a particular problem such as asthma, or maybe you're dealing with a particular problem such as, sciatica, or you're trying to manage scoliosis, or you're trying to implement an additional health care because your father has multiple sclerosis or Parkinson's disease. It's not that chiropractic treats any of those particular issues, it's that we care for the individual spine that concomitantly has the disorder. So understanding that just one concept alone transforms not only the perception of what it is that we do, but the potential of who we can help. So a lot of times too, one of the biggest critics of chiropractic will say, well, there's no evidence. Well, the fact of the matter is that there is, and that there's lots of evidence, and the evidence has been going on for over 100 or so years. So a lot of times a colleague of mine just responded about how they're still focusing on chiropractic and back pain. And this has been going on for about 40, 50 years now. There's been thousands of studies. The question is, in medicine, medicine is very much a fishing kind of approach, where if this medicine doesn't work, you come back and say, Doc, I'm getting a lot of side effects from this. Okay, well, then I'm going to give you something else. Well, that you come back and say, I really don't like this. I'll come back and I'm going to give you something else. So it's like you go fishing. You fish for a little while, you take it out of that hole, you don't get a fish, you go into fish and fish on that hole. The problem is that that approach has led to healthcare costs that are so high. The question is, who's to blame? And the research studies that have come out basically says primary care. And it's not that primary care is wrong, that's what they're trained to do. So when people say to me, Dr. Scott, my doctor did this, I said, well, you have to understand, that's what they're trained to do. And that's the way they're trained in medical school. So here's the problem, here's the drug, here's the surgery, that's it. If it doesn't work, I can't help you. As opposed to, in chiropractic, we're trained to, here's your spine, here's the interference, and here's the problem into the spine, and this is how your body is manifesting. Regardless of whether or not what you're having, we adjust you so that your body functions and heal better, and let the body heal. That's the way we're trained. So can the two work together? Absolutely, as they should, especially with today's problems. The state of Rhode Island, a nice tiny ocean state that's south of Massachusetts, put together a pilot program from the years of 2011 to 2016. And what it was called the Chronic Pain Integrative Program. It was funded by the state. It included chiropractic, acupuncture, and massage. What they did was they took people that had actually had addictive properties or addiction problems, pain issues that were hooked on opioids, and what they did was they came out with the solution, or they came out with the results from that study, which came to be so positive that they've actually presented it nationally. The problem was I presented this information at the last task force meeting at Lawrence Memorial Hospital, only to nobody being interested even what was going on in Rhode Island. And that's why it bothered me in a sense that we're really not focusing in on solutions, because if we were, something like this program would be started a month ago, 2 months ago, January. We're talking about a decrease of almost 30% reduction of medical costs, 61% reduction of emergency room visits, 63% reduction of total prescriptions, 86% reduction of opioid scripts that have been written, and a 96% patient satisfaction rate. Those are stellar projections, and those are stellar results from this trial that took 5 years to accumulate. Why can't Massachusetts take this study that was done in Rhode Island and duplicate it in Massachusetts? It can. We have the resources, we have the funding, we have the patients, we have the physicians, and we have the policymakers to all make this happen. This needs to be done. But at the same time, too, it takes time, it takes resources. So if the public is ready for it, the providers, including myself, we're ready to do it. If you don't think that drugs seem to be a problem, as I'm bringing up my phone here, as I check my emails every single day, and as a resident of Melrose, and as a provider who practices in Melrose, I'm on the patch. And so people that actually read the patch, we always get the headlines. Mexico to Massachusetts, cocaine pipeline. Massive drug bust in Massachusetts and even in Melrose. People, this is a real problem, and we have real solutions. At least we need to incorporate many different modalities and specialties within the health and medical arena to solve these issues. So if we're looking for solutions, if we're looking for pain management solutions, talk to us, talk to me. Ask MMTV where you can get in touch with me, and I'll give that information. At the same time, too, understand that if you do know of someone who relies on medication just to get through the day, tell them to give me a call. Tell them to contact our office. Tell them to look for outside things that are outside the box, because unfortunately today you have to look at the total picture. We just can't be focused in the blinders anymore. The days of drugs and surgery as the only way, that's the only way, is so antiquated. You have to open up the blinders. So whether or not it's utilizing chiropractic, whether or not it's using acupuncture, whether it's addressing massage, whether it's actually consulting your primary to manage all those different modalities, that's fine. Understand too, most physicians don't understand what chiropractic is about, what we diagnose, how we do it. So it really sometimes, even though we've been around for 125 years, people still don't know what we do and how we do it. I want to take this opportunity to thank you for the opportunity to educate Melrose. Like I said before, if you have any questions, my name is Dr. Scott Darragh. I'm located at 340 Main Street, Suite 102, Melrose. Our phone number is 781-662-3333. Hope you guys have a great day. And just remember, it's easier to stay well than to get well.
Isn't it time to take better care of yourself? If you're in the greater Boston area, see if a visit to Bay State Center Family Chiropractic is right for you. Dr. Scott Darragh promotes conservative chiropractic health care for all ages, from day-old infants to the elder population. Alleviate symptoms through total wellness, from chronic pain to migraine headaches, from chronic allergies to ear infections. A relaxed, pain-free visit with Dr. Scott delivers overall wellness by unlocking and unleashing your body's innate potential. Bay State Center Family Chiropractic is conveniently located at 340 Main Street in Melrose, Massachusetts, accepting a variety of healthcare plans. For more information, give Tina a call at 781-662-3333 and visit us online at baystatedc.com.